Hi everyone, welcome. My name is Katrina. I'm a fourth year social work student at Ryerson University, and I'm currently completing my placement practicum with the organization For a Safer Space. So today I want to talk a little bit about coping with mental health during the COVID pandemic. So where are we at right now? We've been going through a tremendous amount of stress and uncertainty as the pandemic hits almost the 1 year mark of its start. But the pandemic brings many challenges, which looks different for everybody. The pandemic is affecting everyone's mental health differently, from frontline workers to women, to elderly folks to people of color. The pandemic is disproportionately affecting people's mental health. And I know this is such a heavy topic, and honestly, we could talk about it for a very, very long time, but I will go briefly and discuss how it does impact, these various groups that I've listed. So we'll start with frontline workers, from the fatigue, from not being able to see their friends and family, from not being able to go home. It definitely takes a toll on their mental health. To women, especially women who are giving birth during this time, being alone during the birth process or their appointments, or just the anxiety and the worries about giving birth during a pandemic. To elderly folks who are not only worried about their own well-being, but having to feel the burden of their loved ones who also feel worried for them. We also talk about virtual care and the shift from in-person appointments to virtual appointments, and how those who don't know how to access or use the technology it's not only impacting their physical health, but their mental health as well. You also look at people of color and how, for example, the pandemic or the virus disproportionately impacts Black folks, which again, many factors and reasons why this is true, which again, whole other topic, but we're not going to talk too much about that. But this just does give a brief overview of how the pandemic does impact everybody differently and how their mental health is impacted differently as well. So let's look at the impacts of our mental health as an overall general view. So if you look at anxiety, since the start of the pandemic, there has been increasing levels of anxiety. Folks are worried about their loved ones or themselves getting sick, losing their jobs, or not being able to afford treatment or rent or food. We look at OCD. With the pandemic comes increased focus on cleanliness, where you have to wash your hands all the time, sanitize what you're touching or using. This has increased levels of obsessive tendencies, as folks worry about being dirty all the time or must clean and wash themselves. And there is a fine line between those who are just trying to stay clean during the pandemic and those who are having increased levels of obsessive tendencies. So it's not to say that everybody is experiencing this, but there has been an increased amount of this. You look at loneliness and depression. So the pandemic has brought on a lockdown and strict social distancing rules. So for many, this means not being able to see their loved ones or friends, which results in higher levels of depression. So what can you do? 1, take care of yourself. Self-care is especially important. Go out for walks, take up a new hobby, catch up on a good book or movie, or many other things. Be mindful of your own news consumption. With so much information about the pandemic, it increases levels of stress and worry. Make sure that you're not over-consuming information, as that can worry you, but make sure that the information that you are reading, watching, looking into, they are from reputable resources, so that you're not getting false information. You want to make sure that you stay connected. So while you can't physically be with some of your loved ones, have virtual meetups and schedule regular phone calls to stay in touch. There's been a lot that you can do online virtually with games or Zoom calls or Skype calls or Google Hangouts. So lots of fun things that you can still do virtually, although it's not the same, but still make sure that you stay connected. And also check in on your loved ones. So make it a point to check in on your own friends and family's well-being and mental health during this time. And so lastly, I put together a couple of resources that you can visit. Most of them are tailored to Canadian or Ontario folks, but you could still check out these websites. They do give really great information as well. So we'll start with the first one. It is Wellness Together Canada, which is free 24/7 support, resources, and counseling with a mental health professional. And this is open to anybody and everyone in Canada. Kids Help Phone, for those aged 18 and under, can call the number on the screen there, and it's available 24/7. Next, we have 211 Ontario, which is a great resource that helps you find resources near you. So you can enter what type of resource you're looking for, and they tell you where they're located, and it shows you which ones are near to you. It's also really nice because it gives a brief overview of maybe potential costs or what services organizations offer before you have to even go in, and it does compile all their information. So their email, their website, their phone number, all that stuff all conveniently on one page. Next, we have Good to Talk, which is free counseling and mental health support for post-secondary students in Ontario or Nova Scotia. If you go to their website, they do have their toll-free numbers for both. We have Together All, which is free online peer-to-peer support, which is available 24/7 as well. And lastly, you have the Canadian Psychological Association, which offers free psychological services to frontline workers. So there you have it, some resources, a little bit of information about how COVID has been impacting all of our mental health. It's really important during this time that you take care of yourselves and your loved ones. And thank you all for listening again. Bye, everyone.